Hi, my name is Janelle Joyce, and I'm a physical therapist with Crossover Health, and I'm here today to talk to you about your feet. Yes, that's right, feet. Stinky, sweaty, smelly, nasty, Epsom salt bathing feet. Why, you might ask? Well, because I think feet are really, really important, and if you've ever worked a long day on your feet, you know how important your feet are too. So welcome to Crossover Health's first video in a series of videos on foot health. In these videos, we're going to teach you a couple of things. We're going to teach you about your feet. We're going to teach you about how to keep them healthy. We'll teach you about foot types and what types of shoes fit best on each type of foot. And we'll even give you a couple of tips and tricks to keep your feet from aching after a long day at work. But first, you might be wondering, who or what is actually Crossover Health? Well, we offer primary care services, physical therapy and chiropractic services, we offer behavior and mental health services, and we even have health coaches who can help guide you along your healthcare journey. Remember, real healthcare is so much more than making you feel better when you're sick. Real healthcare can help prevent you from getting sick in the first place. So, let's step into the main attraction, your feet. I'm not gonna lie to you guys. Feet are very, very complicated. That's why so many different healthcare providers specialize in treating just the feet. Did you know that when you walk around, your feet take up 4 times the force of your body weight? And when you're running, it can be up to 10 times the force of your body weight. So there are a lot of reasons why your feet might get sore and achy after a long day of walking around. Whether you're walking around at work, going to an amusement park with friends and family, or simply going shopping. So to understand why your feet hurt, you must first understand your feet. Most of us know the basics like 2 feet, 10 toes, but we really need to dive a little bit deeper than that. Did you know that your feet have 26 bones, 33 joints, and over 100 tendons, ligaments, and muscles that all work together to help keep you moving? So it's completely understandable that over 80% of the population will have foot pain at some point in their life. But the good news is that most of these problems are both treatable and preventable if you know how to care for your feet in the right way. So hopefully at this point you're asking yourself, okay, Janelle, how do I get to know my feet? Well, to keep things simple, we like to break it down into 3 different foot types: a low arch, a normal arch, and a high arch. And just because we use words like low, high, and normal doesn't mean that one foot type is better than the other. All people will need to care for their feet to keep them healthy in the long run. A high arch means that there is a lot of space between the arch of your foot and the ground. But high arches have a tendency to be more rigid, and they have a harder time dealing with unlevel surfaces and extra weight. A normal arch means that there's a medium amount of space between the arch of your foot and the ground. A normal arch is the most common foot type, and admittedly, it does have the least amount of problems, but that doesn't mean that somebody with a normal arch doesn't have to take care of their feet, because if they don't, they will have problems over time. A low arch means that there's very little to no space between the arch of your foot and the ground. We also call this foot type a flat foot. It also happens to be the type of feet that I have, so hello to all of my fellow flat-footed folk out there. You are in very good company. And you might be wondering, well, now that I know the foot types, how do I figure out what type of foot I have? Well, there's actually a very simple at-home test you can do. All you have to do is get the bottom of your foot wet and step onto a piece of paper, or even dry concrete if you don't have paper laying around. And then take a look at the outline that you left. If there is very little outline on the inside of your foot, it probably means that you have a high arch. If you have about half of that space filled in, it probably means you have a normal arch. And if all of that space is filled in, it means you have a low arch or a flat foot. Now, if you've ever had problems with your feet or were simply curious about your feet, you probably went to Dr. Google or the internet and ran into the term pronation or overpronation. Pronation simply means the amount that your ankle and foot lean inwards when you're walking or standing. Now, pronation is a normal movement for the foot, but overpronation can lead to problems over time. But the good news is that this is often fixed with a good pair of shoes. So make sure you keep your foot type in mind when you go shoe shopping. And also make sure you tune into our next video where we will teach you how to match up what foot type you have with the best type of shoe for it. And if you have any questions about what you've learned here today, please let us know. And if you're having problems or pain with your feet, give us a call or schedule an appointment online to come in and see one of Crossover's many capable providers. Remember, we here at Crossover Health are here for you.